Hello and welcome. Today we're diving into the world of urology to understand a condition called bladder diverticulum. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started. Bladder diverticula are essentially pouches that protrude from the bladder wall. But what causes them? In adults, they're most often acquired, meaning they develop over time. The primary culprit is long-standing bladder outlet obstruction. This obstruction, which can be due to an enlarged prostate in men or urethral strictures in both men and women, forces the bladder to work harder to empty. Over time, this increased pressure weakens the bladder wall, particularly in areas where blood vessels penetrate, leading to the formation of these outpouchings. Congenital diverticula present at birth are much rarer and often associated with underlying genetic conditions like Ehlers-Danlos syndrome or bladder exstrophy. Let's talk about the how of bladder diverticulum development. Imagine the bladder as a balloon. When there's a blockage downstream, like a kink in the hose connected to the balloon, pressure builds up inside. This sustained high pressure weakens the bladder wall, particularly in areas that are naturally weaker. These weak points then begin to bulge outwards, forming a diverticulum. Crucially, these diverticula often lack a muscular layer in their wall, unlike the bladder itself. This means they can't contract effectively to empty, leading to urine stasis within the diverticulum. This retained urine becomes a breeding ground for bacteria, increasing the risk of urinary tract infections and stone formation. Bladder diverticula are relatively uncommon. The exact prevalence is difficult to pinpoint, as many individuals with small diverticula experience no symptoms and therefore never seek medical attention. Acquired diverticula are much more common than congenital ones, and their prevalence increases with age, particularly in men with benign prostatic hyperplasia, or BPH. The incidence also depends on the specific population studied and the methods used for detection. The symptoms of bladder diverticulum can vary widely, from no noticeable signs to significant discomfort. Many people with small diverticula are asymptomatic, however, as the diverticulum grows, or if complications arise, symptoms may develop. These can include frequent urinary tract infections, painful urination, dysuria, urgency, difficulty starting urination as hesitancy, a weak urinary stream, and the feeling of incomplete bladder emptying. In some cases, blood in the urine as hematuria or lower abdominal pain may also occur. Children with congenital diverticula may present with similar symptoms or with urinary retention. Diagnosing a bladder diverticulum typically involves a combination of medical history, physical examination, and imaging studies. A urine analysis is usually performed to rule out infection. Cystoscopy, where a small camera is inserted into the bladder through the urethra, allows direct visualization of the diverticulum. Voiding cystorethrograms, or VCUGs, are often used in children to visualize the bladder and urethra during urination and can detect diverticula. CT scans or MRIs can provide detailed images of the bladder and surrounding structures, helping to determine the size and location of the diverticulum and rule out other potential causes of urinary symptoms. While there isn't a formal classification system for bladder diverticula in the same way as for, say, cancer staging, they can be categorized based on their cause as either congenital or acquired. Congenital diverticula are typically single and located near the ureteral orifices, where the ureters enter the bladder. Acquired diverticula, on the other hand, can be single or multiple and are usually located on the lateral walls of the bladder. Treatment for bladder diverticulum depends on the size of the diverticulum, the presence of symptoms, and the overall health of the patient. Asymptomatic, small diverticula may not require any treatment other than observation. However, for symptomatic diverticula, treatment options include antibiotics for infections, medications to manage bladder outlet obstruction, and surgical removal of the diverticulum, known as diverticulectomy. Diverticulectomy can be performed through open surgery, laparoscopically, or robotically. In cases of bladder outlet obstruction, addressing the underlying cause, such as prostate surgery for BPH, is crucial. Unfortunately, there isn't a direct way to prevent congenital bladder diverticula. However, you can reduce the risk of acquired diverticula by managing factors that contribute to bladder outlet obstruction. For men, this means proactively addressing prostate enlargement with appropriate medical management and lifestyle changes. For both men and women, seeking prompt medical attention for any urinary symptoms, such as difficulty urinating or frequent UTIs, can help identify and treat potential obstructions before they lead to diverticulum formation. Maintaining a healthy weight and avoiding prolonged periods of urine retention can also contribute to bladder health. The prognosis for individuals with bladder diverticulum is generally good, especially with appropriate treatment. Surgical removal of the diverticulum can effectively alleviate symptoms and reduce the risk of complications. However, recurrence is possible if the underlying cause of bladder outlet obstruction is not addressed. Recent research is focused on developing less invasive surgical techniques for diverticulectomy, such as robotic-assisted surgery, which can lead to faster recovery times and reduced complications. Researchers are also investigating the genetic factors involved in congenital diverticula to better understand their development and potentially develop preventative strategies in the future. Thank you for joining us today. We hope you found this explanation of bladder diverticulum helpful.